Right, I'm Dr. Rebecca Kennedy, a family medicine physician, and this is the third part of my series on long COVID and chronic fatigue syndrome. In the first part, we were able to see how many people resolve their symptoms completely. The second part, we learned about the science of neuroplasticity. And in this part, we're going to discuss how does this apply to long COVID and CFS. We're going to go through the science that's out there so that you can understand completely. So we learned about neuroplasticity. Symptoms are made in the brain by neural circuits that get stuck on loop. We learned the power of predictive processing. Our brains are prediction machines, and our unconscious brain creates our experiences for us, largely based on prediction. And with all of this is the understanding that when we rewire the neural circuits, our symptoms can resolve wholly and completely. So let's dive into why does this apply to long COVID and other CFS syndromes? So as we go through this science and we're putting all of the different pieces together, I now want you to start thinking about the symptoms through the lens of the brain, through prediction, through neural circuits creating our symptoms as warning signals, rather than through the lens of structural damage in the body, and then see at the end how all of these pieces make sense for you. So with long COVID, it's a chronic condition. It happens after a COVID infection. It affects all of these different organs throughout the body. The symptoms can come and go. They can happen right after the infection or later. There's no abnormal tests. Most of the tests are normal. The symptoms are worse after physical or mental effort. The main group of people who are affected are actually healthy middle-aged people. Elderly people who have other medical conditions are actually less affected by long COVID. Long COVID happens at higher rates in women, 30 to 45% higher than in men, and also in groups under stress that are marginalized. People with disabilities have an 81% higher risk of developing long COVID. My clinical experience working as the lead of the long COVID clinic at Kaiser Permanente, where we assessed all the people with long COVID among the 500,000 members. So patients came to me and they said, I developed long COVID after having an acute COVID infection. Makes sense, right? Sometimes the symptoms started right after the infection, but sometimes they didn't start for a few months later. But some of the patients said to me, I didn't have a COVID infection. And this was back in 2021, before everyone had had an infection. Patients said, this happened after the vaccine. Well, that doesn't make as much sense, right? Because the long COVID we thought of had to do with a COVID infection. But many people were having long COVID without actually having had the infection yet. So looking at the vaccine, people attribute the symptoms to damage from the vaccine. But some of my patients developed symptoms literally within minutes of getting the vaccine. And then those symptoms lasted for a couple of years and changed and moved around the body. And they developed other symptoms of long COVID. There's nothing physiological that could happen in our body that's some sort of damage from the vaccine that would happen just within minutes and would last for years. It's just not how our body works. But other patients that attribute the long COVID symptoms to the vaccine actually did fine after getting the vaccine. They were back to their baseline health for months, and then the symptoms of long COVID started. And they attribute it to the vaccine. But again, physiologically, it's just not how our body works, that there could be some sort of damage that a vaccine creates in our body that doesn't have any symptoms for months, and then the symptoms start. It's sort of like if you stepped off a curb and twisted your ankle, that event is the reason for the damage in your body and then the consequent symptoms. But the symptoms aren't going to start for weeks or months after you stepped off the curb. It's that same idea. But because our science and our medical system didn't have another explanation for the symptoms, they're often attributed to the vaccine. But more interesting than that is many patients came to me without me asking and said, I neither had the COVID infection nor the vaccine. These are the same symptoms I've had since prior to the pandemic, but now they're worse, and they're the same symptoms of long COVID. So clinically, my experience, as well as the experience of many other physicians, is seeing this pattern of the same sort of symptoms of long COVID in people that it didn't make sense that was happening directly from the COVID infection. Some people, absolutely, yes, it happens, but there's different ways that people developed getting the long COVID diagnosis. So looking at the science is we've spent nearly $2 billion in America looking into structural reasons in the body to explain the symptoms. When we look at history of post-pandemic viral syndromes or ongoing symptoms, these have been reported in the past. In the 1800s, with the Russian flu pandemic, it was reported that many people had ongoing symptoms for months and years afterwards. The same thing happened after the Spanish flu pandemic in the early 1900s, is it was reported that many people had ongoing symptoms, much like long COVID. So the attributes of the COVID virus itself are often being blamed as the reason for long COVID, but we know from the past that other flus that are different than the COVID virus also caused post-pandemic ongoing symptoms. So looking at the science, there have been a lot of theories as to why people have long COVID. Mitochondrial dysfunction, micro blood clots, immune dysfunction, persistent viral particles, metabolic changes, neuroinflammation, hormone changes. All of these are theories, but none of them have been scientifically proven. So let's dive into a little bit of the science that has been done. Looking at the theory of persistent viral particles, there have been a couple of studies. Swank et al. In 2023 did a small study of just about 60 patients. And of the patients with long COVID, 65% of them were found to have persistent spike proteins. But also 35% of the patients with long COVID did not have persistent spike proteins. They redid the study in 2024. That was a larger study, a little over 500 patients. And they found that of the patients with long COVID, 43% of the patients had persistent spike proteins. But again, over 50% of the patients with long COVID did not have persistent spike proteins. They also saw that in the control group, or the group without long COVID, 21% of those patients also had persistent spike proteins. So again, really looking at this science, it doesn't actually make sense that it is the spike proteins that are causing the symptoms, because many people without symptoms have spike proteins, and many people with symptoms don't have spike proteins. And these ideas have not been scientifically validated with repeat studies. So other thoughts were micro blood clots. Pretorius et al. in South Africa did two small studies, one in 2021 with 11 patients, and the other in 2022 with just 80 patients. Fox et al. In 2024 reviewed the studies, and their assessment was that these studies were actually not scientifically rigorous, that it wasn't actually blood clots that were found, but it was amyloid fibrinogen particles, which is just the precursor to making blood clots, but not actual blood clots. And finding these precursors happens in inflammatory states. For instance, with people with diabetes, these same precursors can be found, and they were also present in the healthy controls, or the people without long COVID. So again, the idea that micro blood clots is the reason for the symptoms has not been scientifically validated. There was a study in Nature in 2023 saying that they found biomarkers that were different in people with long COVID than people without. And what those biomarkers were was immune cell changes, antibodies to Epstein-Barr and HSV, and decreased cortisol. Now, all of these changes are not specific. These are biochemical changes that we know can happen when someone is stuck in the chronic sympathetic state or chronically stuck in fight, flight, or freeze. These are all biochemical changes that can happen just from being in that state. And again, are not specific to long COVID per se. So overall, the studies that put forth theories about a structural reason for the cause of long COVID in general have been small studies. They haven't been reproduced and validated. Some have been questionable scientific methods, and some of the findings are consistent with known biochemical responses from the stress response. So again, there's been no scientifically validated information up until this point. When we look at the symptom of brain fog, which is a very typical symptom in many of my patients, and understandably a very scary symptom, there's been research that's been done years even before the pandemic that understands that the prefrontal cortex, which is the part of our brain where we have thinking, memory, concentration, the higher part of our brain, that part of our brain gets shut down when the danger part of our brain is activated. So when our brain is perceiving danger, the danger part of our brain dials up like a dimmer switch. And at that same time, the prefrontal cortex activity dials down because we don't need to be spending our energy doing math when we should be running away from a saber-toothed tiger. It's just like that kid with stage fright. You could practice 1,000 times and then your mind goes blank when you get in front of everybody because the unconscious brain is perceiving danger, and that part of the thinking, concentrating of our brain, part of our brain, gets dialed down. The good news is many, many, many patients who suffer with the symptom of brain fog, it resolves completely with the techniques of addressing the brain and the nervous system. Let's look at the large-scale studies that have been done and see how those pieces of information fit in with the model. There were several very large studies that looked at the history of mental health issues and predisposing one for long COVID. Taquet et al. Looked at over 200,000 patients and found that having a history of PTSD increased their risk of getting long COVID by 75%. Having a history of anxiety increased a person's risk by 50% of developing long COVID, and a history of depression increased a person's risk by 40% of developing long COVID. Wang et al. Looked at 55,000 patients and found that there was 150 to 200% increased risk of developing long COVID when that person was under psychological distress. So again, as we view this through the lens of the brain and the warning signals of the brain, these pieces of information of what's going on for us psychologically of really showing that that predisposes someone to then developing long COVID. The University of Colorado in 2024, as part of the RECOVER study, looked at a wide array of lab tests. They looked at over 10,000 adults and 25 lab tests and found that there was no meaningful differences in the lab tests with people who had long COVID and people who did not. The University of Michigan looked at the history of having something called chronic overlapping pain conditions. And what that is an array of symptoms, most of which I would say are neuroplastic, are things like fibromyalgia, chronic back pain, chronic fatigue. People that had a history of these sorts of disorders were more likely to develop long COVID. So they reviewed 3 million patient records, and they found that after having had an acute COVID infection, a person who had a history of the chronic overlapping pain conditions was at a 47% increased risk of developing long COVID. Interestingly, people who had the flu and didn't actually have COVID were also at increased risk of developing long COVID by 39%, with having had a history of the chronic overlapping pain conditions. And then they also found that there was also an increased risk of getting the diagnosis of long COVID by And that risk was increased by 57% with having a history of chronic overlapping pain conditions, but actually neither having COVID infection nor influenza. Again, really reinforcing the idea that long COVID really makes sense more if you think about it as a post-pandemic stress disorder and reaction by the danger part of our brain rather than due to structural damage in the body. So when we put together all of these different pieces, people can resolve their symptoms wholly and completely. Why it makes sense that if symptoms are neuroplastic and it's brain signaling, that we can turn those off wholly and completely, that looking at all of the pieces of science with long COVID, there's none of it that reinforce that the problem is structural damage in the body. So you may be in a place where that all makes sense. Now, a very, very important common question that my patients ask is, all right, well then why after COVID? Why did this happen to me after getting a COVID infection? And I think a good analogy is to think about filling a bathtub. And if we fill the bathtub with stress and danger and threat and trauma, as we go through our life, through our childhood, our early adulthood, if we're filling our bathtub, it's creating this hypervigilant brain, and the nervous system has learned to respond through threat. So now we've filled our bathtub, and now we've added on the stressors of the pandemic. And so now it's risen even more. And there might be other stressors in our life. And so if our bathtub is full up at the top, now we get a COVID infection, which itself is its own stress, just being sick. And that can be the last drop of water that then makes the bathtub spill over. And that spilling over is our nervous system getting dysregulated and now creating these sensations and these symptoms as warning signals throughout our body. And that can happen by getting the acute COVID infection, even if the infection itself wasn't that bad. It also can happen by getting the vaccine, especially with all of the fear messages, the confusion, the conflict around the vaccine. Again, this is how our unconscious brain is responding to the information, not necessarily just how our conscious brain is responding. So that could be the last trigger that makes the bathtub spill over and then create the symptoms in our body. Then if we don't understand that the very real symptoms in our body, as well as biochemical changes that we can see and feel, sometimes there's swelling, sometimes there's rashes, sometimes our GI system is shut down or our heart rate is going erratically. Those are all biochemical changes in the body, but the root of them is from the perceived danger in the brain. So when we put together all of these different pieces, now we can start to understand why it makes sense that long COVID or chronic fatigue syndrome, ME, is happening because of our brain and our brain signaling stuck in loop versus the generator of it being ongoing structural damage in the body. And the most important piece of information with all of this is that hundreds of people have restored their health wholly and completely around the world. Many, many, many of the hundreds of patients that I've worked with have restored their health. I'm connected with physicians, scientists, patients around the world who have helped people recover and who have recovered themselves. And understanding how our brain and our nervous system works, how all the pieces of science come together, is what allows you to create the understanding of how to move forward, and that you also can get better with the neuroplastic recovery therapies. So these are resources, if you're interested, that I used for this presentation. It's quite a lot. And again, the most important message is that full recovery is possible.